So hi, my name's Nick Harding. I'm a local clinician, but I'm the clinical lead for the Black Country and Western Birmingham STP. The clinical strategy provides a framework by which people can work. So it's the strategic direction in which we want to make sure that health outcomes are getting better for the local population. The clinical strategy is not a finished document. It's some work that we've put together in the 12 chapters to say this is our best thinking on this so far, but we need to improve it, we need to make it better, and we need to see how we can work together to deliver the health outcomes in this document. So it came about by clinicians working locally in the SDP to say, how can we improve quality of services? We got the clinicians together with some of the other local leaders to say, can we produce a framework that we can work towards to produce better health outcomes for our patch, and making sure that was written down in a way that we can agree as a strategy for us to move forward. So the clinical strategy, I think, is trying to do three things. It's trying to say, how will healthcare be better for patients, how will it be better for people working in the system, and how will it be better for using the resources that we've got, so that the quality of care gets better, the people working in the system enjoy that and get more out of their job at work, and actually we use the resources in the best way possible. The way it's going to work is we look at where there is variation, where we say actually things aren't as we expect them to be, and then saying is that right or is that wrong, and where that variation is wrong, we try and put that right. And of course it's all about saying how can we use our staff and make sure our staff are being used in the most effective way to get the best health outcomes for our area. In January this year, the NHS produced a document, the long-term plan, and that's really setting the strategic direction of where we want to go for healthcare over the next 5 to 10 years. An expression of that locally, I think, is our strategic document that says what needs to happen, and so we need the clinical strategy for that for our STP. And obviously that's a job for all of us. It's not just a job for people in the STP, it's a job for us all owning what's going on in our healthcare system and making it better. You get the best outcomes in healthcare where you work in partnership with our patients, with carers, with local people who are working on the front line, and with our providers. So over the summer what we're going to be doing is working with those people, particularly having conversations with them to say, how can we make care better, how can we make health and social care better in our area and produce better health outcomes.